I'm Dr. Thomson, Akwo and Ntuba, the editor of Health and Development magazine, and we are at the Gonzales B Convention Center downtown San Antonio, where we are participating in the American Association of Nurse Practitioners 2016 annual conference. We just finished the session on global health and global health mission and Zika and the others. And with me is one of the presenters. Who are you?
My name is Amy Moore. I'm the director of the Global Health Program at the School of Nursing at Texas Tech University Health Sciences Center.
Thank you very much. You presented a very insightful situation on global health. There are different aspects of global health mission. There is the faith-based aspect and there's the non-faith-based aspect. Like we were told by the military service personnel who was here, that people could be involved in global health through USAID or USAID, or being part of the Peace Corps or even the military. And then they could also go on global health missions through faith-based organization and all of that. How do you encourage and how do you advise them to start?
One of the things that I talked about today is for people who have never gone on a mission trip or an international global trip, is to find an organization that does have experience in doing global health and somebody who has a reputation for doing global health. Some of the things that we look for, are they ethical, and are they safe? Is the trip that they take, is it something that that it doesn't put the participants at risk?
Thank you very much. We are really at the situation where people are thinking that short-term missions may cause good, they may cause harm. What are circumstances under which short-term mission could be harmful?
So when we look at mission trips, any mission trip can be harmful, I think short-term or long-term. But the particular things with the short-terms is sometimes you have groups who go in and they do some medical care, and especially if you go in and you do something like you find somebody who's hypertensive or they're diabetic and you say, oh great, we've caught somebody who has this disease and we're going to treat them, but there's no way for the patient to follow up, or the patient's not educated. So when we do short-term trips, and that is something our school does, but I will follow that to say is that we do multiple short-term trips to the same place, and so we're able to follow up. But we always make sure that the patient has a method to follow up for their disease. We don't treat someone for hypertension unless we know that they have a way to follow up for hypertension. And we do provide a lot of resources and a lot of medications, but I think the number one thing that we do is education. And if we go in and we provide somebody with just some medication and we never educate them on the disease or how to take the medication, we've done more harm than we've done good.
Thank you very much. The American Association of Nurse Practitioners has put up this beautiful workshop because I believe that they are interested in their members going overseas. What would you advise as ways that they could improve and increase the number of members of the AANP who goes on mission?
I think exactly what we've done here today. One thing is word of mouth, doing presentations. I think the AANP, we need to look a little bit closer at what are the groups, what are we doing together. I think one of the things that we did at this workshop is we heard from multiple faculty about global health trips. I think we need to have a better coalition of everybody getting together. What are we doing? What can we learn from each other? I was approached by multiple other nurse practitioners saying, this is something I want to do, and I want to do it in this country. Some of the things that we do as far as education, we do a lot of things with cervical cancer. We also work with other schools of nursing, schools of medicine. We teach different type of skills. We bring simulation into those schools. So I think if we brought everybody who was interested in doing global health work together, we could have a whole conference just on that.
You actually said that global health is not only done overseas, that global health could be done in America. And that is an approach which was taken at the academies when we're looking at improving the quality of care in middle and low-income countries. Some people who are in global health work believe that global health is actually work that is done among the poor and the poor overseas. So I want you to expound on that. Do you really believe that there are poor people in America and that global health could be locally done in the USA?
Absolutely. In global health, I'm going to say global health isn't just poor people. Global health is health that affects everyone. So but there may be differences. You may have difference in cultures even in the United States. But we do have poor people in the United States. We do have people who need care here. And I think that's one thing that groups do help. But, you know, we could help more. But you have to look at disease processes. What does it look like here? What does it look like in another country? The country that we go to, we specifically look at cervical cancer. But there are different strains where we go than we see in the United States that cause cervical cancer, so the HPV. And so I think that's one thing you really have to be aware of is that different diseases may look a little bit different in different countries. But, you know, the thought is we still need to be treating those diseases, but we need to do it everywhere. And it's not always just the poor.